Right. So we're going to start off with some introductions. I am so glad that this group agreed to be panelists for this discussion. So to start things off, we have Jenny Jeremy Markham, who is the Assistant Director at Catawba County Public Libraries. She currently leads the Community Navigator program and has been the task supervisor for interns since 2020. She believes strongly in making libraries a welcoming space where everyone has the opportunity to connect, explore, and grow. And then we have Lucretia Keith, who is the social worker and program manager for New Hanover County Public Library. Lucretia is the first social worker in a library setting in this area and has been asked for assistance from other counties with developing their programs, writing out the job description, and sitting on interviews. She has over 20 years of experience as a social worker, from starting in community-based services to school settings and DSS. We have Justin Stout, who's the head of information services at Neuse Regional Libraries, which serves Lenoir, Jones, and Greene counties in Eastern North Carolina. Sorry about that. He is a graduate of Duke University and North Carolina Central University. And his professional interests include emerging technologies, digital equity, and digital literacy. And then we have Angie Polito, who is the community navigator lead with Randolph County Public Libraries. Angie has over 25 years of experience as a social worker. She developed and implemented the Community Navigator program, which assists residents of Randolph County through all 7 of their libraries to connect with needed resources in their home community. And each panelist will share a little bit more about their context that they work in. Starting off with Jenny.
All right, so my name is Jenny Jeremy Markham, and Catawba County is located in the foothills of the Blue Ridge Mountains. So we're one of the top 100 areas in America to raise a family, probably because of our low property taxes. We have a manufacturing base of furniture, textiles, and communication. And if you don't know where Catawba County is, hopefully you'll remember that Siri lives here, and soon Microsoft will also. And right now FEMA is set up, because we're one of the least damaged counties in the West, to help with the Western North Carolina issues with Helene. So we have a very low unemployment rate, and our graduation rate is actually up to 85%. But like most communities, we are having a increasing struggle with the gap between the rich and poor, the haves and haves not. So we have about 13% of our population that lives below or at the poverty level. US Census data tells us that about 10% of our residents under the age of 65 are living with a disability, and 13% of residents in our county live without health insurance. So that's pretty high for us right now. We're 72% white, 8% Black, 4% Asian, with 11% identifying as Hispanic or Latino. For the library statistics, we have a legal service area of about 120,000. We have 7 branches, plus a library to go and a locker. And of course, I would be remiss if I didn't say we couldn't do all the wonderful things that we're going to talk about without our amazing staff. So we do all of this with 36.3% FTEs. And these people are always doing an amazing job.
All right, and now we have Lucretia sharing about New Hanover County Public Library.
Hello, as she stated, my name is Lucretia Keith. Currently we have 4 sites. We're getting ready to open 2 new sites, one Northeast and Project Grace, which we're going to merge with the museum in New Hanover County. New Hanover County is a big tourist site because of our beaches. We get a lot of people that are unsheltered to come to the area because they feel for some reason that we have a lot more services, and we have a lot more to offer, and we can get them housing quicker than any other part of North Carolina. I don't know where they've gotten that from, but a lot of people from here that are here have came here from other parts of North Carolina. Also, I've seen since I've been here, it's also been a lot of especially during the summer months, people come here because they meet someone online and then things don't go as well as they hoped it would, and they get stuck here. That's been a big thing in the transgender community. They meet someone, they may or may not be honest about it, or the family may not be acceptable to the relationship, and they end up being stuck here. As of April 2023, I serve on a committee, well, I was serving on a committee that did a pig count. We have 558 unsheltered people in New Hanover County. These are some of the numbers that I have from September 2023 to September 2022 to September 2023, just the services that I mainly offer and what they came in needing and what they offer, anything from education, assistance with paying a bill, health insurance, dealing with abuse or domestic violence, medical care, mental health services, volunteering, housing, transportation, locating family, Social Security inquiries, job applications, job searches, resumes, and help seeking food. My biggest thing that I find myself helping with is seeking food, jobs, and housing. If we can go to the next slide, okay. So this also breaks it down from September 2023 to September 2024. And if you can see, the numbers have increased. Other, which says other for 147. So there may be anything from needing help finding school supplies, needing help with transportation, but we have transportation here. It may be like today, for example, I had to go out and assist someone who had a disability get his job back. The owner of the grocery store wasn't understanding of his disability. So we sat down and came up with a plan to better assist and support. And after talking to him, he was able to hire this person back after we came up with a plan. So that would go up under other. And it just breaks down my resources needed and the resources offered. And that's basically it. Sometimes they come in and I really can't help them. I try my best to for example, Friday I had someone who came in and it was like 4 o'clock and they needed help paying their rent that was due Tuesday. So I did the best I could with referring them out to resources, but at this point, it's kind of too late. So the numbers for the resources needed and the resources offered are always the same, as you can see. And then some of the places that I refer them to: Wilmington Housing Authority, the Harrison Center, Coastal Horizons, Veteran Services, Health and Human Resources, VR, DV Shelter, Med North, Mother Hubbard, RHA, NC Works. There's a plethora of places that I refer them out to.
Thank you, Lucretia. Angie, if you're ready to share.
I think
Wait, Justin.
All right, my name is Justin Stout. I'm the head of information services for Neuse Regional Libraries. We serve Lenoir, Jones, and Greene counties. Our service population is about 87,000 people. It's definitely a mix between a small town environment. Kinston is where our headquarters is located, and it is more of a small town environment, but a lot of our region is pretty heavily rural. We have some serious issues with the digital divide and broadband equity in our community. So a lot of our initiatives have focused on trying to address those particular issues. We have had a social worker on staff for about 2 years now. I'm going to tell you a lot more about that later, but it has definitely significantly impacted how we offer information services and reference services in our library. So I'm here to offer my perspective on that to you today. Just some fun facts about our region. We were the location of the PBS series A Chef's Life. We're home to Mother Earth Brewing, and we were called America's Basketball Heaven by ESPN in 2018 due to the high ratio of high school basketballers who have played in the NBA. Jerry Stackhouse, Brandon Ingram, Reggie Bullock, a lot more. They've all come from Kinston. So, yep.
Awesome. Thanks, Justin. Angie, if you want to close us out on this intro.
I'm Angie Polito, Community Navigator with the Randolph County Public Libraries. We have 2 social workers who cover all 7 of our libraries. We are right in the middle of the state. Our county logo is Randolph County Serving with Heart from the heart of North Carolina. We are also known because the zoo is here. And we are known, Richard Petty, I forgot to put Richard Petty on my slide. And then, of course, we have all the potteries in Seagrove. Randolph County is a mainly rural county. We are growing. We currently have 146,000 plus residents, but with Toyota opening a plant here, Wolfspeed, which is right outside Randolph County in Chatham County, and then we're also getting the Ross Distribution Center. We are having a real struggle at this time regarding housing. 16% of the population of Randolph County does have some sort of food insecurities, and 18% of our children live in poverty.
All right, now we will switch gears and go into the panel discussion. Our first question is, when did the library decide to incorporate social workers into their services, and how has that partnership impacted your patrons? For this question, we'll have Jenny start things off, and then Angie, Lucretia, and Justin will follow.
All right, so we started in 2019 by writing an LSTA grant for $42,000 to get us 2 paid interns. They were working about 24 hours each, just for 1 semester. So please don't reinvent the wheel. If you want to see a copy of the grant application that I submitted, you've got my contact information. I'll be more than happy to share that. After that, though, we've moved into unpaid internship. We host bachelors of social work as well as masters of social work students, and then some health and human resources students. So I've worked with Appalachian State, Lenore-Rhine, and UNC Charlotte, and hopefully more to come. So the reason why we started this was not COVID related. For us, we like to identify a problem and then identify how the library can be part of that solution. So in 2019, 2020, our point in time count of the homeless rate was trending upward. We had 310 people experiencing homelessness. Other agencies that were serving in our community were experiencing increases in services. Home delivery meals were up. Partners Behavioral Health Management reported rates of substance abuse and mental health crisis visits. Emergency room visits were up. Our crisis intervention program was serving more than 2,500 families. Low-income energy assistance programs were serving 985 families. And I say all of this because that research went into our stats for the grant. And so anytime you can find these stats to put into a grant, it always makes it more compelling. United Way calls were up, and those were mostly about needing help with housing, shelter, and utility bills. So with all of those departments working very diligently to handle all of the rising needs, we thought maybe we can expand access and build capacity and reach out to more people, especially those in those vulnerable populations. So we're also, our main library is located within walking distance of the jail and the courthouse. So we also have a soup kitchen around the corner from us. So we naturally serve as a day shelter for a lot of people. And library staff was finding themselves trying to imitate the role of a social worker without those benefits of professional training. So the process of applying for resources, as you know, can be very complicated, and there are clearly ways to improve communication between agencies. They do a great job, but you have to have this list of papers to go to this place, this list of papers to go to this place. You have to fax them, you have to print them. Sometimes they have to be scanned. It's a lot to do. So we thought, how can we help people who come into the library already at their wits' end, agitated? They come in not usually seeking us as a first source, like Lucretia said, but for us, they come in when they've exhausted everything else. So we just recognized that there was a need for a community navigator, but we weren't even familiar with that term until we started doing a poverty simulation here. And it was hosted by the state library, and several participants started commenting on the difficulty of navigating all those resources that they learned about during the poverty simulation. So again, we just started to think about, hey, how can we break down those barriers? How can we help people access resources more efficiently and more effectively? So we're all about that inclusive library experience, that universal design concept. If it's good for one, it's good for all. So we built relationships with the schools, and we built relationships with the different community resources out there. And I don't know if it's because of us, but I will say there have definitely been a reduction in homelessness. So we're in 2022, we're down to 261 people experiencing homelessness in Catawba County. We didn't ban a lot of people for behaviors before this, but we banned all of 5 people in the last 4 years. And I think that has a lot to do with the training that we got for our staff, and as well as the relationships that have been built with our community navigators. Our collaborative partners have increased. We also do a lot more than just the community navigator, and we can talk about that later, but we have a closed closet. We offer free COVID tests. We have food provided from outside agencies. And of course, we have a much better relationship with law enforcement, since we're able to de-escalate a lot of the situations here. So I want to say that means better overall service for all of our patrons. And our staff feel more confident in how they're able to help people. Best of all, well, not best of all, I'm sorry, that's a little horn tooting there. This program did win a NACO award, which is the National Association of County Achievement. And it does help us promote this program to those who may not understand the value of having a community navigator. And it also lets our county commissioners and managers know that this is an important process. Sorry, that was a mouthful.
No, thank you. Angie, any thoughts?
Okay, y'all bear with me just one second. Right in the middle, the heat and air people come in. So sorry about that. They're in the process of replacing the heat and air here in our library, and I had this room reserved so that I wouldn't be interrupted. But anyway, okay. So I started here with Randolph County Public Libraries in February of 2022. Decision was made to bring a social worker into the library after COVID, as a result of seeing a lot of individuals and families coming in as things opened back up after COVID, who were needing help connecting with resources in the community and just not knowing where to go to get those resources. The initial intent was that I would work mainly with families with children and hopefully help front load services to prevent involvement with Child Protective Services. That so is not what I do. I do a lot of work with those that are unsheltered. I am the main point of contact for Randolph County for coordinated entry. Actually, at the moment, I'm the only agency that has access to HMIS, the state database for the homeless. I lead our point in time count for Randolph County. That's just a little bit about what I do and how it came to be here in Randolph County. How has having a social worker here in the library impacted our patrons. We have some that are great to see resources in place and us helping those individuals and families that need services and resources. But then at the same time, we're also bringing in more individuals that are unsheltered, those that have mental illness, those that have substance use disorder. And there are some patrons that aren't happy with that. We also have some staff that aren't happy with that. So we are doing more trainings with staff around mental health, around substance use disorders, and also trying to do some educational pieces in the community as well.
Thanks, Angie. Lucretia, if you want to share.
So I came on in 2021. From my understanding from talking to staff and the person who hired me, they have been advocating and trying to get a social worker due to the need of needing one because of the greatness of the unsheltered population. Our numbers are extremely high. And so a position opened within the library of a program manager that was over the Smart Start program, if I'm not mistaken. So I came in and took her place. So I was able to be hired through the county, unlike some people who have grants or other things. I'm a county employee. And let me just first off start by saying social workers not social workers, librarians wear many, many hats. They have to be the social worker, they have to be the teacher, they have to be the ticket taker or ticket finder for Ticketmaster. So the librarians here were playing social work roles, but not well educated in what social workers do and how we can go about doing those things, as well as the behaviors here from the unsheltered population are extremely high because we are a day shelter. We're a woman's shelter, we're a cooling shelter, we're all of that. And so they were trying to put out fires and navigate through the resources in the community. So when I came in, I researched and set back each site, and each site has a different need based on the location, but everything is still the same. They have a high number of unsheltered population. We have one site on the beach, and there are a lot of people that are unsheltered on the beach. I know you're quite common with the Mayfair area, and they have a lot of unsheltered there too as well. So I came in, I created a community resource packet. And so this packet tells you every resource in the county, and it's a Google Google Doc, and I change it daily. So say you're looking for, because I can't be at all four, it'll be soon 6 places at one time. But say if you're looking for housing, you go flip up till you find housing or clothing, and it tells you everywhere in the area that offers clothing, and so forth and so on. And so I think that was a great help to the librarians. And I have a office cell phone that if I'm at one place or out in the community, because once I came here, I was asked to be on several boards. I had the pick count. I work closely with the domestic violence shelter. So they know to teams me or contact me. I want to take some of that pressure off the librarians because they do a lot. And the partnership has impacted the patrons because they know now, schedule an appointment with the social worker. We have a social worker here. We have someone that can advocate for us. We have someone that can let us know about the community resources, such as the government phones, or such as now is Christmas time. So the Salvation Army Angel Tree program. So they know now to first ask for me, rather than to come into the library and just let the librarians be a dumping ground. They know now, and I'm encouraging the librarians to redirect them to me, because that's what I'm here for. And I speak to the librarians as well. This is just not for the patrons, it's for them, because sometimes they don't know how to deal with behaviors from the unsheltered or the community in general. So I speak with them on how to handle things. Even though this person may have a mental health disability, that does not give them the right to come in and to curse you out, to curse the other patrons out, and this is how you handle this. And we do have a pretty high ban list, but it's not permanent bans. It's 36. We give, but it's okay to ban because we're in a society that behaviors have consequences, and they have to learn how to live outside of the library and function with rules. So, you know, the librarians here, before they put you on a ban, they deal with a lot. So I'm not just here for the patrons, I'm here for the librarians as well. And community, because I work closely with APS and CPS, helping them find resources as well. So that's it. I hope I answered it well.
Yeah. We have a question from Eulea, I think, in response to what you mentioned, Lucretia, about, could you mention the type of data that went into your research? Housing/unhoused, United Way, day shelter stats, etc.
Okay, so hold up. Were you talking about in relation to this?
I think so, yes.
Okay, so what I did is, being that I have over 20 years of experience in not just in this county, but in other counties, I knew what my major resources were. So so say we have Good Shepherd, and I would go to Good Shepherd, that's a shelter. And I would say, well, can you tell me who would I go to if you were full? Who would I go to if this person needed diapers? And then I would go reach out to that person. They might say, well, let me give you First Fruit. So when I went to First Fruit, and I would get their resources, and then I would contact who First Fruit told me, and talking to patrons, because let me tell you something. The unsheltered, I can't speak for other places, but for here, they know their resources and they know who to reach out to get what they need. So they would tell me, oh, well, let me just tell you this, Miss Lucretia, thank you for putting me on with Trillium, but let me tell you about this resource. And then before I would enter it in here, I would always contact them. And when they would contact me and say, no, we don't have the funding at this time, but let me give you the Harrison Center. And that's just how I build my resources.
Yeah, and then you have that Google Doc that you can
Right, it's
constantly
ongoing. I change
update.
it, I research it. I gotta change it today because we lost a dental program that was free. But when I contact them, I'm sure that they'll give me, well, we are closing, but let me put you on to someone else.
Right, and then kind of following that sort
Right.
of chain. Justin, if you'd like to share, when did the library decide to incorporate social workers?
Sure. So our social work referral service, which we call Let's Connect, dates back to 2020. But even just to echo what other people have said, long before then, we were noticing that we were getting a lot of questions at the information services desk that we weren't really fully equipped to answer. I mean, we would try to find the answer the best we could, but we just didn't have that deep familiarity with community resources that a trained social worker has. And so we were noticing that we were having patrons that were in some pretty serious situations, needing help, and we were only able to help them so much. And then in 2020, our assistant director went to PLA and attended a conference session there, Sarah Seaver, and she really was inspired to start a program, a social worker program at our library. So we, just like Jenny mentioned, we applied for an LSTA grant. At that time, the program was called the Mind Over Matter program because it also included programming for mental health and general well-being for our patrons. And eventually that would become the Let's Connect program. Also around that time, I think 2021 was our first year, we started having a social work intern from East Carolina University each spring semester. So yeah, and it has impacted our library in a lot of really great ways. Our current social worker, Joyce Hawkins, she started 2 years ago. She has helped people find jobs, find housing. She's helped veterans find veterans housing specifically. She's helped people with disabilities find disability services. She's helped people with vision care, all kinds of different things. And it really has impacted how we look at our information services. We do a lot more pop-up programs now for the people that kind of hang out in the library for the day. We try to go and play a game with them or play a puzzle and just get to know them. I mean, we've been able to build relationships with our patrons because of this. We do outreach at the local soup kitchen, and it's really amazing to me. You'll notice that like half the people that come through the line, we can greet them by name because we've gotten to know them through these types of services. So yeah, it's really made a tremendous difference in our library, and I'll talk a little bit more about that later.
Great. Thanks, Justin. All right. So we are on to question number 2. As a social worker collaborating with library staff, what key insights would you share to help train staff in effectively supporting and working alongside social workers? So for this question, Angie will lead things off, and then Lucretia, Justin, and Jenny will follow.
Okay, so when I started in 2022, I quickly realized that our staff, our library staff, weren't really on the same page that I was. I had all this experience as a social worker. They thought that I would be here for a couple of weeks and just kind of settle in, get to kind of know everybody. But within 2 days, I had referrals and was going out working with individuals in the community, making some home visits. We only do that on a limited. But I also quickly realized that our staff needed some additional training. I wasn't here long and had an individual that I was working with who had some severe mental illness, who made a comment about planning to harm himself, and had gone out and asked for assistance, and our library staff didn't really know what to do. So I realized that we need to do some additional training. So I have brought in some staff from other county agencies that have done training on what to look for human trafficking, because we are right here near 85 and 40, 2 major highways. So we do have the possibility for some human trafficking. I do believe that there's been a couple of ladies that I have worked with that may be victims of human trafficking, but getting them to cooperate and admit that has been a challenge. Also, like I said earlier, doing some mental health training. We are working on for sometime after the first of the new year, we are going to do an all-staff training, and part of that training will include substance use disorders, like what to look for if somebody's in the library and they may actively be using, or may be high or impaired or coming down from a high. Not only what to look for, but also ways that staff can respond and help if needed. That's mainly going to just be to call 911. And we have had to call 911 quite a bit since I have been here, which that was a new thing. Staff were not used to that. Patrons aren't used to seeing the cops in the library. They're not used to seeing EMS here or the fire department, but sometimes that is a necessity. So it has been a different experience for me as well as our staff, and has involved quite a bit of learning on both sides.
So with me, it would be going out, getting the information and bringing it back to my counterparts here at the library. I just came back from Alabama with a social work training, and the key major thing there was self-care. And I brought that back because as I see librarians, social workers, you get burnout easily. You're dealing with the public is a burnout. You're dealing with different personalities, and you can't take care of anyone else until you take care of yourself first. So I like to go out. I attend a lot of different trainings, and I bring them back to the community. I mean, to my counterparts, the librarians, and not even just the librarians, but everybody within the library that can benefit from those trainings, and just having that communication. with them. You letting them know that I have an open door policy if there's an issue that, and I tell them all the time, if there's something that you want to be trained on, if there's something that you're interested in learning about, let me know so I can go out and get that, get trained on it if I'm not trained on it, and bring it back to you guys. Next year is going to be, I've already told them that we're going to shift things in another perspective, in another way. Is going to be more, I get trained, and then I train you guys on things such as, say, for example, the big thing now is the Medicare Part A, Part B, those type things. A lot of clients are getting tricked or don't understand what they're signing up for. And then you got that, if you want to change, you got that 30-day lapse in service. So once I get trained on that, I'll train them, not because I want them to know, but you never know. I might be out with a illness, or I might be at a different site. And so instead of them waiting on me to handle it, if it's a big, quick question, hey, this is what you need to do, or this is who you need to contact. So that's what I'll be doing. But as soon as I get the information, I'm always taking a class. I'm always taking a training about sex trafficking, because that's a big thing here. Staying up to base on transgender LGBT community. When I get that information, I share it abroad. And that's what's going to keep us all on the same level and keep us above.
The biggest thing that we have done, Joyce has offered some training to staff, but the biggest thing we have done is kind of similar to Lucretia's Google Doc. We have created a resource guide for staff that's basically just a big directory of all the community resources. It's great to have Joyce be available for people when they need more complex referrals and consultations, but we have 8 locations plus our digital resource rover, so she can't be everywhere. But with her help, we worked together and we put a lot of time into it, a lot of hours, but we built a resource guide using LibGuides that we've made publicly available. And we've broken it up into the 3 counties in our region, and we basically made categories kind of similar to like what Lucretia said. For our categories are clothing and furniture assistance, disability services, domestic violence assistance, emergency assistance, employment and libraries, food services, government and law enforcement, housing and homeowners assistance, legal services, mental health and substance abuse, physical health, senior and veteran services, utilities and transportation, youth services, and community centers. So now our staff are able to go to that resource guide, and of course it's specifically tailored to our community. It's a listing of all the resources in our community. Anytime they have a patron come and ask them about what services are available for the particular problem they're facing, they can go to that resource guide and pull them up and just get a list of all the different resources available, plus contact information and a little bit of information about what the organization does. So that's the biggest thing we've done, is just make that information available for staff, even if they can't immediately get to Joyce for the information. And there will be a link to that resource guide at the end of this presentation too.
So like people were saying earlier, we still expect our librarians to be able to answer all of these questions when our community navigators are not available. So we are training our staff with Ryan Dowd training, which is free and available on Niche Academy. He is really good about de-escalation techniques, which I think are good for all customers. Again, it's that whole inclusive design. So, and many of the topics that Angie mentioned, like recognizing drug use or human trafficking, Niche Academy has different trainings on that. We also schedule mental health first aid training. We were able to do that free of charge and do it as a staff day. We encourage our staff to take training based on trauma-informed care and whole person librarianship. And we do this because it's so helpful when we build relationships with people. And that way, when there's an issue, we can say, oh, that's just John, we know him. Again, it helps us reduce those behavioral issues and the people that are not so welcoming for those folks that might be experiencing mental health issues, or maybe those that are unhoused. Ryan Dowd might call them sometimes jerks with homes. When they see issues happening in the library, we can help de-escalate their responses as well. And again, that is our numbers of behavioral issues are decreasing, even though our door counts are increasing. But it is interesting, as somebody pointed out earlier too, that we get as much feedback from patrons that aren't unhoused as patrons that are housed. We do the resource guide also. We do it through a LibGuide, and I think Lucretia said that has to be updated on the daily. Yes, those resources change. Another thing that we did was specifically how to work with law enforcement and with EMS or behavioral health partners when they come out. So we have, how to make that phone call, what information to give, meet the officers outside, let them know what you're trying to do and how you can have this situation go better. And again, that's in that de-escalating training with Ryan Dowd. And then we also ask our community navigators to survey or provide some type of training to our staff that is very specifically staff related. So last year's was all about self-care and what it looks like in our library. So it is a lot of making sure that our staff are empowered to make those decisions and that they feel comfortable in case our community navigators aren't there.
All right, thank you, panelists, for a great response to that question. So we have question 3. How does bringing in a social worker integrate with existing library services? And Justin will start things off, followed by Angie, Jenny, and Lucretia.
Yeah, this was definitely a huge priority for us from the beginning of our Let's Connect program, is we wanted to integrate it with the rest of our library services because there is such a huge overlap with a lot of the other things that we're doing. We really do see ourselves as a community center these days. That's been kind of central to most of our initiatives over the past few years, is recognizing that the library is one of the few places left that acts as a true community center where people from the entire community can come and enjoy free resources. So for one thing, Joyce, our social worker, she actually works at the information services desk. So she is part of our information services staff. She does desk hours. It helps her visibility. It gets her out there. People are aware that she's there. She's able to promote her services from there. And when we get the weird questions, it makes it, or I'm sorry, the difficult questions, the ones that we're unfamiliar with, then it's very easy to get her in there and working with the patient and get them the information that they need. She goes out with us on a lot of different outreach. When we go to the local shelter to do digital literacy outreach, she goes with us to introduce herself there. She goes out on our digital resource rover, which is our 21st century bookmobile that we take out to the community. We go to a lot of community centers as well as public housing. So that helps increase her visibility and the visibility of her program there as well. And the biggest way is we do a literacy program here at the library. We don't have a literacy council in our region. So again, back in around 2020, we applied for an LSTA grant to start a literacy program at our library, specifically an adult literacy program. And so obviously the first couple of years during COVID, it was difficult for us to connect with people, but we also just felt in general there was not the awareness in the underserved populations of that service being available. So we kind of realized that there's a lot of overlap in the people that need the Let's Connect service and the people that need the Literacy Without Barriers adult literacy service. A lot of the people that are experiencing these emergency situations also are having difficulty achieving their life goals because of literacy issues. So she helped us start marketing that to the community, and we had a lot more success reaching the communities that really could benefit from that program. We do digital literacy, we do adult basic literacy, which includes reading, writing, math. We do ESL students as well. So she has really helped us reach those communities. When she goes out on outreach, she advertises both Literacy Without Barriers and Let's Connect at the same time. And it's gotten to the point now where she is the coordinator for the literacy program as well, just because she's so good at matching the tutors and the students for that program. So really, we've recognized that there's huge overlap in Let's Connect and all the other different things we're doing, and we've been able to integrate it pretty successfully with these other services.
Okay, y'all bear with me. The saw's going upstairs, so hopefully y'all can hear. I'm kind of an extension of our library staff. If they are working with a patron who has an issue that's beyond what they can help with, then they oftentimes will come get me. I am also part of our outreach team, so I do a lot of outreach events in the community, resource fairs to not only promote the Community Navigator program within the library, but also to promote upcoming programs, our children's services programs, anything that's going on in the library. I do a lot of those community outreach events. I also have myself and the other community navigator. We are in all 7 libraries, and we have a set schedule so that individuals know when we will be in each library, and we have office hours so that they can call and schedule a time to meet with us. We do have phone numbers, desk number and cell so that they can reach us. But we just work really closely with our library staff to meet individual needs.
So, yeah, with that community centers of excellence, that's where libraries are going. So and hopefully are getting there or are already there, rather than shushing people, we're to that welcoming spaces. So we are, this fits with our mission and vision of connecting people with resources, and it's a lot of different resources that we connect people with. So we do ask our community navigators to sit outside of their little office pods. They learn to scan, copy facts. It is amazing how, as you're doing that, somebody's got a resume they need help with, it moves into what other resources they may need help with. And then we move from conversation to, I love what Roundup County says, need help finding help. So that's how we kind of handle it. And I think it works in conjunction with what our staff are already doing. While our numbers are increasing of people who are coming through the door specifically for our social workers, like Lucretia said earlier, our staff are handling all of that. So these more in-depth meetings can be handled by our community navigators, and that does take a large burden off of our staff.
I'm sorry. So I'm just here. This is what I say. I'm here to assist, support, and make the jobs of librarians and library staff in general easier. So what I did when I first came here, because I want to work closely with them, I sat back and watched and observed, and I saw the needs of certain things. For example, a lot of librarians were coming to me because they were unsure on how to help the IDDD population. The IDDD population wanted to sit in on story time or some of the kids' activities, but they're 30. But because of their disability, they don't understand that it's not quite appropriate for them to be in an adult story time. So what I did, I created adult IDDD programs for just tailored to them. And every month we do a story time and we do an activity. I supervise the core, which is community outreach, reading empowerment, which is another thing for the bookmobile. But it's a whole program. So every month he has activities from exercise to the book club to decorating Christmas tree ornaments. And not only does he takes our books in the community, but he does the programs here and he does them at facilities within the community. So I supervise that. We're always constantly talking about how we can be more out in the community and make, even though you're out in the community, make you feel like you're a part of the community. So I'm constantly talking to the librarians to see what areas do you need me to be in, what can I do so we can all work together. And I'm constantly looking to see what the community needs. I've held programs here that nobody wants to talk about, hospice. But hospice is going into a different direction. And it's not just about, okay, here's hospice, you dying, but it also talk about how to create, about wills and about power of attorneys and about signatures that you need. So, because people wait till, I've learned that people wait till the 11th hour and then call the librarians and think that the librarian is supposed to know all the answers and give it to them right now. No, I can't call you back. I need these answers right now. So that's where I'm at with that. We're always working together to see how that we can make this area, New Hanover County, great, not just for just this one, but all libraries and the ones that are being created currently.
You're being asked to be legal aid at certain points, is that?
Yes, I'm
Yeah.
being asked. I'm getting ready to start an expungement program. I'm helping people fill out divorce paperwork. I'm helping people fill out paperwork on getting custody of their children. I'm doing, it's supposed to be a program here. I don't know if you know about it. It's called SOAR program. And it's supposed to help people get their disability benefits. But the steps to go through it is so crazy that people don't have, like, they got to see you 3 times and then you got to bring this and you got to bring that. Well, you come to me, we schedule an appointment, I help you fill out the paperwork, and I advocate for you. And with them, with SOAR, they'll tell them, you haven't been to the doctor enough, so we can't help you. I don't do that. And people they have turned away, I have been able to get Social Security for them. So once that word gets out, they don't even bother with SOAR anymore. I've advocated, not only do I just help with existing library staff, I help with the community, which helps stop them from contacting the library, so to say. So I take some of that pressure off on the forefront with like Wilmington Housing Authority or the Harrison Center. So I go to a lot of meetings to get a lot of stuff to bring back to them so we can work smarter and not harder. That's what my goal is.
Yeah, you're like taking the pressure off of
Right, that's what I'm trying to do.
them.
Yeah, I want to take the pressure off because I honest to God, before I started this job, I always thought librarians was like stocking the shelves and saying, shh, don't talk too loud. I didn't realize how much they have to do and how much they have to
Mhm.
deal with on a daily basis. And then the library is open 7 days a week. That's a lot. So if I'm here, if I can help you do whatever, I will.
Yeah. With our last question before Q&A, what advice do you have for starting a program with social workers at your library? So this is for the registrants who shared that they do not have a social worker on staff and might be interested or exploring that idea. For this, Lucretia will start things off, and then Jenny, Justin, and Angie will follow.
I would say start doing the database like I do. If you have a moment, or do documentation. How many people come in for housing? How many people come in for Medicaid? How many people come in for social programs or shoes or food? And document that and how much time you spent on helping that person if possible. Go to your director, show them the need for the services and what you could be doing with those 24 minutes that you spent or those 30 minutes that you spent on this, as opposed to you could have been shelving, you could have been doing something else, coming up with another program. Also, I encourage you to also attend your county commissioners meetings or see that if this is a possibility that they would, if they can't create, I'm blessed because I am a county employee, but everybody's not a county employee. So do your research and see if you can write a grant, see what your options is. I'm not a take no person. If you tell me no, I coin the term, I'm gonna get behind the why. Why is it a no? How can we work around this thing? So if they're telling you no, we can't create a county position for this, okay, so let's just discuss our options. And when you come to the table as, okay, let's do the research on the internships and how it can be spun to help offset the cost, and having one, or just say, let's try this one social worker for a year and see how much of a change it brings. So that's what but my biggest thing is having the people go to the director, but mainly attend your county commissioner meetings.
Yeah, and to piggyback off of that, we align our goals with our county goals. So our county did a community health assessment. We looked at that. Part of the problem was connecting people with resources. So again, figure out what the problem is and how the library can solve it. Write those awards, write those grants. We also got a training award through the NCPLDA. Our county likes having that in front of them and gets all the credit and kudos. So it doesn't, you can accomplish a lot if somebody else gets the kudos. Definitely start small, talk with others who have done it, attend university career fairs if you're going the way of interns versus position. And like all librarians do, learn as much as you can. Once you do have somebody on staff, though, definitely review those learning agreements and those expectations and understand your contracts processes. Oh my goodness, that is a whole different ball game there. And build upon your momentum. So reach out to your local elected officials, your newspapers, write those articles, apply for more grants, go on your local TV and radio shows, and then build your contacts and leverage those.
Yeah, I would just echo that. The LSTA grant program is such a great resource for doing things like this to start out. Obviously, you will have to come up with a plan long-term to sustain the position, but it's a great way to get started with it. We look at it always as a way to do pilot programs, to get things started, to put it out there and show that it can be successful, and then demonstrate its value to the community, so that the people that do make funding decisions can have hard evidence that this is going to work. The intern option is a good one too. That's how we started out. Obviously, it's not going to be the same as a professional, fully trained social worker, but there are also benefits to the intern as well. Our resource guide started as an intern project, so that can help you get a project like that started. And I would just say, if you can get the social workers started, the way to get the program started, just make sure you do lots and lots of outreach, because it's great to be able to help the people that come through our doors, but there's a lot of people who never come here that need a lot of help in the community as well, that might not necessarily go to DSS, but they still could use some help. So outreach is always a great way. Flyer outreach is good. Talking to people is even better, but just to get the word about the program out in the community.
And I agree with what they all have said ahead of me. When we started our program here, we got buy-in from some of our other big county programs, public health, Department of Social Services, our partnership for children. And so all four together went to the county commissioners, and we started with strategic planning money. So we were just temporary for a year, and then that got extended to 2 years. And I will have been here 3 years in January, and we are hoping with our budget year next summer that we will actually be part of the Randolph County Library budget going forward. But yeah, get your commissioners involved in your other county agencies.
All right, now I know we had some questions come in via chat. So we have a question from Elia asking, what are the most unique places that you have completed outreach?
I will say the most successful places we've had have been food pantries, because that's one of the things that kind of was shocking to me, was just how many food pantries there are in our community. I was just completely unaware. But that has definitely been the most successful place. I know our social worker will go to do flyer outreach at like places like barbershops and laundromats too. Just any place in the community where you think a lot of people go that might not otherwise hear about the service, I think is a valuable place to go.
For me, it's been out in the streets, like we have a high population in the parks and by the railroad track. I'm out there, in the domestic violence shelter and with DSS, because they're overwhelmed and they think about the same 4 or 5 resources. So they send a whole lot of clients to me in regard, because I normally keep a housing list of who's renting to people who accept rent private pay, who can pay for rent, who's giving away food, and they normally they're like a can type thing. So they're thinking about the same for people. So they send a lot of people to me. But my biggest outreach is out in the streets. And once you tell those 3 or 4 unsheltered or 3 or 4 people that are not necessarily unsheltered, the word gets out and they bring them back, send them back.
I have been out with one of our city workers to several of our homeless camps. And like Lucretia said, you work with one, then 2 or 3 more come in. And then after that, it's kind of a trickle effect and hopefully work with lots of individuals. I've also been down to our local prison. We have a prison here. It's a reentry prison, and we are working on getting a reentry council for Randolph County. And I am part of that. I'm the temporary case manager for that program as part of my role as community navigator. So
we also put flyers in like the backpacker program at school, the food pantries, like you were saying, blessing boxes. We'll put flyers everywhere, and then just out on the streets, shopping markets, you name it, we're there.
We have a question that came in earlier. How do you get staff buy-in for these programs?
I'll say from the staff's perspective, a lot of times we are very happy to have assistance in this area because it has been an area of frustration for us for years, for sure, where we didn't feel like we were fully equipped to handle this. So I think if you present it in that way, that this is here for you to have something to help you when you encounter reference questions that you feel unable to answer. Yeah, I think that has not been an issue for us, for sure. I think people are happy to have the help in this area.
Yeah, especially here too, their staff are extremely supportive, and I never had to do a buy-in. They were glad that some of the pressure was taken off their shoulders and off their hands. And I have a wonderful director who I meet with frequently, who wants to know, how can she support me? How can she advocate for me? How can she make sure that I have the resources that I need? So here at New Hanover County, I didn't have to buy in. I just had to come in and introduce myself, and it just went from there because they were glad for the help.
Yeah, we didn't need buy-in here.
yeah, the staff here was super glad when I started, and they tell me all the time that I handle stuff that they have no idea how they would have ever navigated through it.
Same here.
We have a question, just one last question. Sometimes staff are part of underserved communities. What are some things you do for staff members experiencing this?
So we do have staff members who use our community navigators. Same rules of confidentiality apply with them, and it has been a seamless process so far. We haven't had any issues.
Same here. I've had a lot of staff that have come to me about, mental health resources, medical not being able to afford. So they use the community resource packet, or just seeing that if I can contact someone for them in regards to getting mom into a assisted living facility or things of that nature. Number one top priority is everything is confidential. I treat them like I treat my client. And what I do, I have an intake that form that I use that creates that tool, but I don't put their name in. I put confidential or undisclosed. Undisclosed. I don't put their name.
And that may be another way to get staff buy-in as well, because our staff do use this. It's usually paid time. We don't know if they're popping in there for some help.
We have Eulea asking if, Lucretia, you'd be able to share a copy of that form in some way.
I put the link in. If you scroll up, you should see the link.
Awesome. I'll save this chat so that I can send out those links to different resources We have a couple of resources listed so far. So the Neuse Regional Libraries Resource Guide, the Ryan Down Training on Niche Academy, some resources and training from Web Junction. But folks, we are going to wrap things up because we're a couple of minutes over time, and I do want to make sure that everyone's able to wrap up and enjoy the rest of their Monday.